On the 27th of March, South Africa began a hard lockdown, which saw the curbing of all movement except for essential services. This was a contagion stage to flatten the curve of the global pandemic. But the reality was different.
It might be the first day of lockdown across the country, but here in Alexandra, it's business as usual. We've seen people milling the streets from the early hours of the morning. We were here at just before 8, and the line that you can see here outside this supermarket doubled in size. The queue starts here and snakes around the corner for almost a kilometer.
The army was deployed to enforce lockdown regulations. However, the line between enforcement and homicide was crossed. Colin Kosa was killed by soldiers at his Alexandra home. As the days wore on, people were getting tired and irritated. By April, regulations were slowly being eased. With level 3, the economy reopened. But this has caused a spike in cases. This week, the health minister announced that the province could emerge as the epicenter in the next few weeks. And judging by the numbers this week alone, this is fast becoming a reality.
The storm has arrived in Gauteng, the COVID-19 storm.
But many are not convinced that the virus is a reality.
It is such a pity. As you can see this place in Alexandra, my main concern is a lot of people is they don't believe in it. I'm very disappointed to say this. It has always been level 1 at this place. It has never been level 3. It has never been level 5. It has never been level 4. People, they live as if this disease does not exist at all.
I don't believe that COVID-19 exists because I don't know anyone who has died from it.
I don't think my community is taking it seriously because everyone is walking around like it's normal. Everyone is treating it like it's nothing wrong. Like there's nothing wrong, like there's no coronavirus.
I am worried because no, life doesn't feel normal.
I feel very fearful about it, and people are not adhering to restrictions.
Masks are still few and far between, with hygiene protocols rarely heeded.
Why aren't you wearing a mask?
Well, I do have the mask. Well, at the moment, I failed to talk with you when I haven't got the mask.
With no behavioral changes, the numbers are expected to soar. Health facilities are already inundated, with more beds needed in hospitals. Currently, the private and public sector have just over 8,000 beds to treat COVID-19 patients.
The field hospitals that we are putting in, they are not going to act as critical care beds. They will be helping us in a great deal to manage patients that are in need of continuation of care after they've been stabilized. And we are looking at close to 2,000 beds. We are adding up 500 beds in Nazareth, 500 beds in Tshwane, and the other 700 beds around Ekurhuleni, where we will be working with the South African National Defence Force.
This week, most hospitals were overcrowded. The department is looking at measures to decongest facilities for critical patients.
One of the things that the quarantine isolation centers can assist us with, and it's something that we're exploring again, it's around the decongesting of our hospitals. So once we have, positive COVID-19 cases in our hospitals that are stable and can either be discharged or either go home, but alternatively they can come to these isolation centers to, sort of the 14-day period to spend it here. So these facilities can also be used to decongest our hospitals and free up some of the much needed beds.
In a densely populated province like Gauteng, social distancing is almost impossible.
If I had my way, I would have been quarantined myself at home, but we are staying in a small flat. We are 5. Actually, I didn't count my helper. My husband went away for his quarantine, and then me, I asked my doctor to get me a space as well, so that at home it must be only my helper and my kids, so that we must not clutter.
Facilities are being set up to assist.
We're in Nasrec, south of Johannesburg, at one of the isolation and quarantine centers. Behind us is the red zone. There is where patients who have tested positive for COVID-19 and are unable to self-isolate are then brought here.
Gauteng is expected to reach 120,000 coronavirus cases by the end of July, leading to an unavoidable overcrowding of hospitals.
As the Provincial Command Council in our province, we are having consultation processes to look at making representation to the National Command Council on reinstating some of the harsher stringent measures. And what do we mean by that? So basically, in addition to ward-based response teams, we think there are areas, there may be a case for localized lockdown, harder lockdown being localized in some of the areas where things are just getting out of hand. The infection rate is just getting out of hand, and people are not observing any of the measures that have been put in place.
Decisions made in this meeting is expected to be communicated to the National Command Council next week. Hasina Gori, SABC News, Johannesburg.